Okay, team. So bring it on in, like tighten it up. Bring in the end game. Tight end. We need some tight ends here. We want to talk to you a little bit this morning about football. Actually, we won't. We want to talk to you a little bit about healthcare. As you know, everyone standing here, the legislature, the governor, Vermonters are committed to creating the first single-payer healthcare in the country, where healthcare is a right and not a privilege, and where we design the first affordable cost containment system in the country so that healthcare doesn't bankrupt our businesses and bankrupt the middle class. That's what's happening now. There's been some discussion in the legislature about the exchange, working with my administration to implement what the federal law requires. As you probably know, states have two options. One is to design their own exchange. The other is, if they fail to do so under federal law, to have the federal government design it for you. We feel strongly that the exchange is not the answer to all Vermont's healthcare problems. In other words, if you were simply to pass an exchange, we would not contain cost adequately and be able to provide universal access adequately with those saved dollars. So we feel that as we design an exchange, it should have maximum flexibility and allow shoppers to make choices for insurance until we implement our plan in Vermont that gives them many of the same options that they have today, but buying it in the exchange. In short, we believe that allowing for the quote-unquote bronze plan and allowing employers with more than 50 employees to shop outside the exchange should be permissible, for the simple reason that we believe that the exchange will be the place that Vermonters shop for insurance, and we want to allow maximum flexibility as allowed by federal law. So I want to give the Speaker and Senator Ayer, on behalf of the Senate Chairwoman of the Senate Health and Welfare Committee, an opportunity to say a few words, and then we'll answer any questions.
Thanks,
Mr. Speaker.
So we have been working with the administration and with the Senate over the last several weeks, discussing how we will design the healthcare exchange for the people of Vermont and Vermont businesses. One of the decision points has been whether we would use 50 employees as the cutoff for entry into the exchange or 100. We know that those employers with 100 or less employees will come into the exchange in 2016. The question is whether they should come in 2014. We decided that we would give the exchange a chance to work over the next couple of years, and we would put in the small group employers of 50 employees and less, as well as the individuals who are looking for access to the insurance market. This gives us an opportunity to allow the exchange to work, and also gives small group employers the opportunity to have a larger pool to be working with. We believe that it will be an effective way for them to get insurance to their employees, and it does allow them to access some federal monies for tax credits and premium subsidies. And in this whole debate, that has been lost, that there are opportunities for employers to have their employees have more access to coverage at a cheaper rate with the subsidies. And I think that this will allow us to work through that. With regard to the question of whether we would allow bronze plans or silver and gold, we believe that it's appropriate for us to work through at this point in time with the silver, gold, and bronze plans, which will allow under all three of them to have people have deductible plans like HSAs. So I've enjoyed working with the administration and the great team that they have and with the Senate to reach the conclusions that we reached. Our House Healthcare Committee is going to continue to work hard on this bill, and I expect that they will move the bill either by the end of the week or early next week. We've had a very busy first month of the session. We continue to keep that pace up over the next couple of weeks. Thanks.
Thank you, Mr. Speaker. Senator Ayer on behalf of the Senate.
Thank you. Senator John Campbell, the President Pro Tem, sends his greetings and his regret that he can't be here this morning. We support the governor's proposal, and with the thinking that the exchange is a small step on the way to universal health care. We'll slow down a little bit, we'll do it right. This will give us a chance to fine-tune some of the areas within the exchange. And it gives us more time in the Senate to work on issues about health care rather than insurance. There's still a lot of work to be done, looking at cost savings initiatives and so on, so we can be ready when the time is right to move toward universal health care for Vermont. Thank you.
And I want to thank Chairman Fisher for being here as well. Do you want to say anything?
I'll say a few words. So thank you. I want to start by saying that the Speaker gave me an excellent committee. We've just been spending the last couple of weeks digging into all the details of this bill, and around the table with me is a doctor, is a couple of nurses, a couple small business people, and we've been studying carefully the issues that is being talked about here today. While we haven't made that decision yet, I feel confident that the majority of the committee is strongly with us in this proposal to define small business, the small businesses as under 50, and to allow Browns in the small group market. So I'm happy to stand with the administration and with the Senate on this, and believe that we're on our way to completing our work on defining the exchange so that we can move on to the more important work of moving to universal health care.
We have Commissioners Kimball and Larson with us. Be happy to answer any questions that you might have, if you have them.
Did this come in response to the reaction you've gotten from businesses?
It really came as a response to the fact that I feel strongly, and the legislative leadership agrees, that we're spending an awful lot of energy on something that isn't going to solve all of Vermont's problems, and our energy would be better spent in other ways. Listen, the exchange will not solve all Vermont's healthcare problems. What it will do is allow us to get as many people into a area to shop for insurance where, as the Speaker just mentioned, we can draw down on hundreds of millions of dollars of federal tax credits that will help Vermont businesses and individuals get access to insurance. But we all know that the work of the Green Mountain Healthcare Board is much bigger than an exchange, and there is absolutely no harm in allowing maximum flexibility in the exchange for as long as the federal government allows us to do so. Yeah.
Terry, I don't think that businesses speak with one voice on this issue. There are definitely businesses who have 100 employees or less who would like the opportunity to avail themselves of the exchange and the tax credits and the subsidies for their employees, and they'd like to be part of that market. And there are those who are less desirous of being in that market. But you know, this was a hard decision. This is a very hard decision because there are people who will not have the opportunity to get into that market, and they'll have to wait 2 years, and their employees will have to wait 2 years as well. So it wasn't an easy decision, and there were differences of opinion on this one.
When you say it's a hard decision because some people won't be able to take advantage of it, won't that be their choice?
No. When you preclude, the federal law requires businesses of 100 or less to be in exchange by 2016. We're now saying that they can stay out until 2014. When you limit it to 50, those larger businesses cannot buy into the exchange for 2 years.
Can you describe Browns as a consumer?
Sure.
What does Browns feel like?
Browns feels like what most HSAs, or many HSAs, offer currently in Vermont, where you have a high deductible. In many cases, businesses pay a portion of the deductible for their employees. It can be as high as $2,000, $2,500 or more. And as soon as you reach that deductible, the policy begins to pay, the insurer begins to pay. So basically, a bronze plan is a fairly high deductible. And let's be honest about this. Those are being offered throughout Vermont, and there are an awful lot of businesses in Vermont right now who are offering high deductibles, and some choose to put money in their employees' HSA accounts, which is allowed by law, that allows that deductible to have less of a sting for the employee.
So if the exchange is not going to really have an effect on controlling costs of healthcare, is there something in this bill that you think will?
The exchange will allow Vermont businesses and individuals to access huge tax subsidies that will help us all pay for health insurance in Vermont. There are other pieces of the bill that I'll let Representative Fisher and Senator Ayer speak to if you wish, but really we feel that there's been too much energy spent on arguing over the details of an exchange that are not going to solve all Vermont's healthcare problems. We all know that. The exchange will play an important role in drawing down federal tax dollars, in giving Vermonters one place to shop for health insurance instead of this confusing mix now. And let's talk dollars and cents. The purpose of the exchange for us is to help Vermonters save the $20 million that they're currently paying to brokers that should be used for health insurance. So that's really where the rubber hits the road here.
Can I just clarify something before? This talks about the proposal that would allow businesses with more than 50 employees to remain outside the exchange. Does it mean allow or require?
The federal government actually requires it. You have a choice. You either do 50 or 100. For 2 years between 2014 and 16, if you choose 50, if you have 51 employees, you cannot shop in the exchange.
Is this a recognition of some sort that things were moving too fast, or it was just too much to try and do all this quicker?
No, we're not moving fast enough. And our challenge in Vermont is, let's remember what this discussion is about. In a state where we're struggling to finally create jobs and see some economic recovery, my view is that the biggest obstacle to business in this recovery is the rising cost of health insurance for their employees. What's kicking the middle class in the teeth in Vermont is the rising cost of health care in Vermont. It's not sustainable. So the Green Mountain Healthcare Board is trying to design the first cost containment system in the country that's going to work. This is how the math works. By 2015, at current rates of growth, Vermonters will be spending an additional $1.2 billion on health care that we're not spending today. That works out to about $2,500 for every living Vermonter, or a family of four, $10,000 out of Vermonters' pockets or Vermont businesses' pockets that they're not spending right now by 2015. This will cripple job growth, it will kick the middle class in the teeth, and it will continue to prohibit job growth because employers have to spend money that they would invest in innovation, technology, new jobs, on healthcare. So we are doing what no other state is trying to do. Design the first quality cost containment system in the country, universal access, where healthcare is a right, not a privilege, and where we get it off our employers' backs. That's the goal. So can we move fast enough? No. Are we moving as fast as we possibly can? Absolutely. And the Green Mountain Health Care Board is going to meet the mandate of the single payer law in Vermont of coming back with a plan to contain cost so that we can move forward in 2014.
So I've heard when I first started learning about the exchange that it was going to be something of a stepping stone towards single payer. And then I've heard from other folks that they're kind of separate. So is this an indication that maybe it's not such a stepping stone, that it's just a federal requirement?
It will help us. Let me tell you how it will help us. We're drawing down millions and millions of dollars of federal money that's helping us build the data system to move us to a single payer healthcare system. As an example, we got $28 million just a few weeks ago to help us with the technology and other investments we need to make to have a single data point so that we can actually pay a bill when you get out of the provider's office universally, instead of wasting 8 or 9 cents on every dollar chasing money around. So you can actually have that Green Mountain Healthcare card be a pipeline to your medical records, so we stop duplicating and wasting inefficiencies in the system. So the exchange and the federal bill is tremendously helpful to Vermont in bringing us federal dollars to achieve our single payer goal. The exchange itself is not the panacea to all of our problems and challenges in Vermont.
It does actually, the exchange itself sets up a single pipe from which employers with 50 employees or fewer are buying from. So it actually does start to bring a group of employers and the individual group market into one space to buy their health insurance. And I think that is a step along the way to creating a pipeline for everybody to be able to buy their health insurance in one place.
So it's a helpful tool, but it is by no means the solution to Vermont's challenges.
So if the exchange is not the place for you to spend a lot of energy, I think you said that a couple of times, where is the spot that you want to put your energy into in terms of healthcare this year?
Bringing healthcare providers, businesses, consumers, and the Vermont community into the process with the Green Mountain Healthcare Board so that we can design the first cost containment system in America that works. Let's not forget, Vermont's trying to do something that everybody that we compete with for jobs outside of this great state has already figured out. Europe, Asia, Canada, and other countries. They're spending less than half, in many cases, of what we spend on healthcare with better outcomes. We're spending our healthcare dollars with irrational exuberance, and we don't get the kind of outcomes that they get in other countries. So Vermont's trying to do something that, frankly, all of America should be trying to do, which is deliver a quality healthcare system where healthcare is a right and not a privilege, and where we use our healthcare dollars to make people healthy again, not insurance company profits, waste, inefficiency, and an unsustainable spending path.
So say I work for an employer who's got 45 employees and they offer a bronze plan, and I don't want a bronze plan, I want a platinum plan. Can I then go into the exchange as an individual to get that better plan, or would that employee be stuck with it?
Well, I often say, don't ask questions about the new system that aren't different in the old system. As a small employer, before I became governor, any of my employees has the option to opt out of the health care plan that we provide and go buy insurance somewhere else if they choose. It's no different under this system. You don't? Of course it is.
The exchange offers some flexibility for employees for employers to offer a set of benefits. Say, I'm going to offer this much towards your purchase of health care, and for the employee to say, I'd like a richer plan. I'd like to put some of my own money and move from a bronze up to a silver. That's true. That's one of the things the exchange does offer in terms of providing better access for Vermonters.
I would argue you can do that under current law, though.
Absolutely.
If an employee comes to me and says they want to do that, I say go for it. So it's no different than the existing law.
So now the exchange is going to be functioning for a year until you move to what you ultimately want?
Well, the exchange is going to be functioning for a year for 50 employees, and then of course in 2016 it will go to 100 employees under federal law.
2017 now is the
2016.
But at which you want to go to
I want to get there soon, and we're going to get there as quickly as we can. My hope is that we can have Vermont on a universal health care plan by 2014. As you know, we need some help from the federal government to get that done. There is some presidential politics involved and congressional politics. There's an election coming up, but we believe we can get it done by 2014. That's my goal. I think 2017 is longer than Vermont can afford to wait, because if we don't start getting our costs under control with a real cost containment system, it just means that we'll be spending another, instead of 1.2 by 2015, who knows what's going to be, 1.6 billion? We just don't have the dollars. Listen, I'm surprised somehow how this conversation is distracted from the facts that really matter. The facts that really matter are these. I don't think there are very many people in Vermont, providers, business people, or individuals, families, who would tell you that the current rate of growth in our healthcare system is sustainable. That's kind of a big one. It's not a lot talking about the corner store going out of business or the corner laundromat. It's our healthcare system. It is perilously close to a cost increase on an annual basis that will bankrupt our small businesses and bankrupt the middle class. So what Vermont's trying to do that the rest of the country hasn't gotten right yet is use our healthcare dollars to make people healthy again, not for inefficiency, waste, abuse, profits for insurance companies. I think we can do it. We got to do it soon. 2014 would be ideal.
One more technical question. The individuals and small employers, the 50 or fewer, are they still going to be required to buy insurance off the exchange?
Yes, absolutely. And the reason we feel so strongly about that is that there are hundreds of millions of federal tax credits coming to Vermont once we get the system up and running in 2014. And it's incredibly important that we have as many Vermonters in the exchange to be able to take advantage of those tax credits for business as well as for the individuals.
I need to pull the governor for the next.
Anything that we
Stay
missed,
around.
team?
No.
Thanks so much for joining us.
The